balance, still on animal husbandry, particularly dog breeding, or what I call dog caregiving. I'm going to be giving some care to my dog this morning by name Foxy. So come with me as I take you through some basic care processes you can give to a dog. So first, let me brush the fur. This is to avoid entanglement. When you brush the fur this way, it helps to avoid entanglement so that it looks really nice and very attractive. It also helps to bring out some surface ticks that might be laid on the surface of the fur. So this action helps to prevent entanglement in dogs' fur. That's Foxy looking at the camera now, wondering what is happening right about now. Okay, so I'm done with this aspect. Trying to follow up my movements on his fur or all over his body to clean his fur from entanglement from dirt, and like I said earlier, from surface ticks, fleas or lice that might be on the line. Okay, next I have a tick picker. We call it a tick picker. It's a simple instrument or a handheld instrument used to pick out ticks from the body or the ears of dogs. So I'll take a look at the ear in case there is anyone. There's none. Here, I think there's none, but I can see something I can pick here with the tick picker. So it goes this way, push it forward this way, then I quickly pick the tick. It's reacting because it doesn't like the posture, but I just have to do it for its own health. So you go this way and pick out the tick like this. You pick out the tick and crush. Pick out the tick and crush. Okay, so that's about the tick picker. Next, actually giving this medication, he suffered from stooling with a spot or touch of blood. That's like purging or stooling in puppies or dogs. So to take care of this condition, which has already caused it to lose some weight, so for it to recover quickly and very fast, I needed to consult my vet doctor to get the following drugs. One of them is Liverfit B. You can see it's a vitamin B complex to also boost its immunity. I have MGL syrup. It's a suspension that is also administered to dogs. I have Astapicin. Astapicin is an ampicillin oral suspension syrup that is also administered to control the stooling. Then I have vitamin C. Vitamin C is also to boost its immunity, to prevent it from infections that could cause stooling, that can make his immunity system weak in order to fight against diseases or any incoming infection. And all this is meant to help bring it back to normalcy. Then I have this particular drug here, Lemotil. Lemotil is an additional medication or prescription for this purpose in order to help his stool become strong or thick stool formation, to avoid it being watery. So altogether, this combination gives us the therapy in order to avoid one, dehydration, to return his stool back to normal or his excreta, also to return its immune system to the degree that it can fight against diseases. So I'll be administering each of these at different levels. Then before I go, I also have the tick and flea spray here. This is meant to take care of ectoparasites, referred to external parasites. So this helps to kill the ticks from outside, apart from hand picking with the tick picker, and prevent ectoparasites from feasting on his blood and causing infections or sickness. Okay, so these are the combination. Foxy is trying to escape right now, trying to avoid this process, but it's very charming. So here I go. I'll start with this. Now the measurement for this prescription is to be administered 5 ml each. Each of the syrup is administered 5 ml. So you shake. After shaking, properly. Then I'll measure 5 mil into this calibrated container. So here I go. Yeah, this is 5 mil. Then I drop this. I go with the next. This vitamin C. The next prescription to be added to this is the vitamin B complex. I'll have to shake properly. Then I also give it a 5 mil measurement to make it 10 mil altogether. So I'm just giving it 2 syrup at a go so that I can make the process faster instead of giving it one after the other, because the dog actually struggles with this medication, but it's all for her overall health. Okay, so having done that, next is to administer the drugs. I'm going to drop a tablet of the lemotsin inside so that it just ingests everything in his body. Okay, I have to add this one. Wait. Okay, so that is that. I'm going to drop this now. So watch me as I put it in the position where I can administer the drug. It struggles, but I just have to do this. Okay, so Foxy, sit. It sits down. It's trying to struggle. It doesn't like the process, but I have to do it. Sit down, sit, and stop that. Okay. Part of the process, part of the drill. From your good Foxy. It will struggle, but that's it. Okay, now it has it, and I've shut the mouth and make sure it goes in this way. You're going to add to it. Someone's trying to bite me now. Okay, then allow it to rest for a while, allow it to relax. And it does that. Give him a pat on the back. He's angry with me. He's being angry right now. He's being angry right now, but you have to give him a pat on the back. You have to calm her down. Yes. It's coming down now. Ready for the next dose. Okay, so I'm going to measure the next dose into this container. So I'll be administering the oral suspension. This is to prevent dehydration, because she has lost a lot of water while stooling excessively. So oral rehydration now comes in. Trying to run away. Just stay calm, Foxy. Okay, so right now I'm going to measure another 5 milliliters into the calibrated container. She's aggressive right now because she didn't like the posture and the procedure she just underwent. Now the next measurement, which is the last but not the least, is the MGO suspension, which is part of the prescription for healthiness. So I'm going to measure another 5 ml of this as prescribed by the veterinary doctor. Add it to it, and the dose is ready. So here I go. I'll cap it up. And bring Foxy back to her position to get the medication. She will fight me, of course, just like confining you in a place and you don't like the position, or you don't like being confined, or you don't like certain treatments. But this is for her well-being, so it has to be done. So I make sure she sit down. She struggles much. Foxy, sit down, sit. Yes, after sitting down. I know you don't like this. So it's time to administer. Oh, she spilled that one, but part of it has gone into the mouth. It's not easy administering drug to a dog because it's a carnivore and it can always bite because they are readily available to bite in a case like this. So she's taking the drugs now. Taking the drugs. I shut the mouth to make sure she doesn't spill it out. Yes, now it has taken the drug. So Foxy is good to go. How did you see that? So that's how to administer prescribed drugs or medication to your puppy whenever in such condition. Now I just try to take care of constant stooling with blood spots, then dehydration and loss of weight. After a few number of days, she will recover and start to eat and get bigger again. Lastly, to take care of ectoparasites or external parasites. Ectoparasite simply refers to parasites that infest an animal from the external environment by attaching to their fur and holding on to their skin. What they do is that they continue to suck the blood for their meal in order to stay alive because it's part of the food chain, and in turn the dog suffers harm. The host in this case is the dog named Foxy. Foxy is the host. The ticks are the external parasite being hosted by her body. So to avoid the attack, we use a tick and flea spray. It's a prepared chemical formula that helps to deal with ectoparasite. It's an externally prepared chemical formula that helps to deal with tick and fleas on the body of puppies. You know why you have to do this? You have to do this because you need to take care of external parasites in order to avoid infection from the external part. Then also for the internal part, which is the internal environment, we need to deal with endoparasites. The word endo simply means inside. And to take care of endoparasites, she has undergone 2 doses or 2 stages of vaccination, awaiting the 3rd vaccination stage to deal with endoparasites. When you're able to take care of ecto and endoparasites, that's external and internal, then you can store your puppy or the tap. You turn on the spray tap like this, then you spray all over the body, but with care not to enter the eyes or nose or mouth of the dog or puppy, as you can see in this case. So you spray all over the body. When you do that, you also go in between the legs. You can spray at the tip of the ear, not inside the ear, the tip of the ear, because the chemical can be adverse or can be very harmful to the skin in the ear at the delicate organ. Spray at the tip like this, and in between Then the same for the legs, that's the hind legs, the hind limbs here. Just same for the hind limbs. Then any tick that is found around these areas has been taken care of externally, and the dog is whole. So here is Foxy. Foxy, say hi to the camera and say hi to the audience. Foxy is ready for abuse. Foxy.